Hey there, my name is Megan Clanahan. I am the co-owner of Houston Moms. Today we are bringing you another health video from our friends and partners at UTMB Health. They are preferred providers in the League City, Bay Area, Galveston, all you people in the Southeast, go see UTMB Health. And today we are talking about all things sports medicine and sports injury related. A lot of our kids have hopped back into the fall sports season. And so we thought it would be top of mind to kind of bring you some tips about sports injuries, when you should be concerned, when you should head to the ER, when you should go to urgent care, how you should talk to your doctor, all of those things. So we brought in an expert. Dr. Leung is a primary care physician, right?
Yes, that's correct.
Okay, you want to tell us a little bit about yourself?
Yes, my name is Stacy Leung. So I actually grew up in the Clear Lake area. I'm very local and I graduated at U of H. So I'm thrilled to be back in practicing in the Southeast area. I do family medicine as well as primary care sports medicine.
Perfect. Well, we're so glad you're back in your space. So it's always nice to have a local person with us. So because you obviously know the area and what can happen and being an expert in sports medicine. So let's get right to it. Are there tiers when it comes to sports injuries? Like kids are launching into, soccer, football, all the things this fall. How do we know when an injury is bad enough for the ER, or should we go to urgent care, or should we see our primary care the next day? What does that look like?
So I actually think this is a great question. This is even something I think generally people don't really know about. So I really think it's important to try to differentiate. So for me, I think the easiest way to kind of break it down is how much of an emergency do you feel like it is? We're going to see our kids and those who are like flailing in pain. I mean, it breaks your heart. And so you really want to make sure that they get the proper care. I think emergencies for the emergency room, I would say you would consider like a super emergency. If there's a lot of bleeding, or if you feel like, oh my gosh, does this need stitches? If your kids won't be able to tolerate a bunch of like needles for numbing, then you would probably go to the emergency room. Anything that's like a really obviously broken or dislocated, or if it's dislocated, sometimes when they're playing on the fields, their athletic trainers and coaches will try to reduce these and they don't go back in. Well, that would definitely require emergency room.
Okay.
If you also are thinking about, well, do they need advanced imaging like a CT or an MRI? So anything that's like internal damage that we worry about, also emergency room, as well as uncontrolled pain. If you're trying to console your kids or giving them ibuprofen or Tylenol, they can't swallow it or they won't stop crying, definitely want to go to the emergency room.
You touched on there that sometimes things can be handled on the field or on the sideline, if you will, and by the athletic training support staff at your child's school or club ball or whatever it may be. What is the typical follow-up process? Like if they treat something for your child in real time and it seems like they're doing okay, how do you follow up with, or should you follow up with your primary care?
Yeah, that's a great question. I think, of course, if there's any concern of injury, they should follow up and be evaluated. Your athletic trainers or the on-site medical team, they're really to triage any acute injury. And then anything beyond that, though, you definitely want to go in to get evaluated to see if you do need any like x-rays or imaging or what other treatments that we need. Because we want to make sure that we catch these injuries early so that they don't cause prolonged damage in the future. If it's the weekend, I would say urgent cares are also very appropriate in the non-emergency situations. I know
Okay.
during football season, we also have a lot of sports clinics. So they do have x-ray on site and a lot of providers who are familiar with sports injuries.
Oh, that's good to know. Especially all those Friday night football people.
Exactly.
Oh gosh. I'm a new mama to, well, my kid has played flag for years, but
Uh-huh.
now is playing tackle in junior high
Oh,
my
yeah.
largest thing. And so this is a very timely topic for me because I'm like, oh, like to stay healthy. So speaking of staying healthy, so what happens? I mean, these kids are going to practice, they're practicing a lot. Um, what do we do about injuries that happen during practice? Does it differ during games? Like, how should we treat these?
So I think it's going to be at the discretion of whoever's on site to evaluate, to be honest. A lot of times, people will say, play through the pain, but you want to make sure that if you're worried about an injury, you don't continue playing. We want to get you evaluated and make sure everything is okay before we send kids back in to play, whether it be practice or in a real game. I know, especially like those, big championship games when we're down to the wire, a lot of our athletes are just going to want to jump back in there, but we have to also be mindful that we don't want them to have or sustain any long-term damage.
Yeah, it's so hard because
Yeah.
you're in it to win it, and then you have to get pulled out. So I think that comes down to a lot of like communication. What kind of communication do you need to be having with like the coaches and the training support staff prior to seasons or like even now? Like, well, what should we be talking to these guys or girls about?
Yeah, I think that just communicating, like if a child gets injured, an athlete is injured, and the parent's not available there, that maybe we'll have to have the kids be pulled and sit out until we can determine, can they be seen by their pediatrician or do they need to go to an urgent care? And just knowing that, the athletic trainers and the medical staff are professionals, they also know what they're doing. If they do feel comfortable sending somebody back into the game, I would trust that, and if they don't, well, you also have to listen sometimes, even though we don't want to.
Good advice there. Um, so, again, a lot of the kids are jumping into sports. What kind of conversations do we need to be having with our primary care physicians, if any, before they start playing?
I definitely think it's really important to be transparent with your primary care physician. You want to talk about what sports your athlete is playing and talk about their medical conditions. For instance, if somebody has asthma, they need an extra inhaler to be on the sidelines or with them with their backpacks, in their backpacks, where they can really easily access it and not have it in their lockers. And so your physician's going to need to send you a prescription for an extra inhaler, and these are things that are very important. Not just that, but I mean, if we have kids who are allergic to bees and we're playing outside and, there are bushes and trees and pollen and flowers, I mean, they might be needing to carry an EpiPen. So I definitely think it's important to talk about what sport and what kind of environment you're going to be in, as long as also with what kind of medical issues your athlete has.
Such great advice. It was actually ironic. We were playing last week, and there was a kid who had asthma,
Mm-hmm.
and a dad was screaming from the stands that
Mm,
he needed his inhaler, but his inhaler wasn't on site.
yeah.
Um, and so, I mean, that's like a perfect example of why we need to let our primary care know so we can have extras of all of that stuff. For sure. And the EpiPen, I even think about food allergies too. And they do game day meals. And if your child has some sort of allergy, then you never know.
Absolutely.
Be prepared. So, good conversations to have with your primary care. We always encourage all of your transparency with your primary care, which, by the way, UTMB has a great list. If you don't have a primary care that you trust and know, we'll put the list below for you guys so you can go find one like Dr. Leung that you love. Um, so, going into concussions. So, obviously, this is also top of mind, especially in fall football season. What do we need to know about concussion? What do they look like? What do we need to be aware of?
Yeah, so I think concussions are kind of tricky. So sometimes we think of it only as very impactful head-to-head contact, but a lot of times it can occur even though the impact doesn't look that severe and we just aren't recognizing it.
Mm.
So, everyone is susceptible, but Just knowing that an athlete has had prior concussions makes them higher risk for having future concussions. Athletes who also have histories of like migraines or headache disorders or mental health issues or learning disabilities, they might have a longer recovery time, or a more challenging recovery. So major things to watch out for are like common symptoms are headaches, dizziness, blurred vision, balance problems, and even being more emotional. Sometimes parents will be like, well, they seem fine, but very sensitive, and I'm like, well, that's part of the concussion as well. So we definitely need to keep that in mind.
I had no idea. I'm also interesting on the longer recovery time. Um, I have kids that suffer with both learning disability and headaches. And so interesting to know. Into kind of like an orthopedic situation. So let's say worst case happens. How do y'all coordinate care with an orthopedic team? What does that look like as you kind of like have to transition, like if surgery is needed, rehab, recovery, what does that look like?
Yeah, so we definitely work closely with our orthopedic team and we trust their judgment a lot. I know no parent wants to hear, oh, yeah, my young athlete needs to go for surgery, but sometimes the healing process would be more detrimental if it healed naturally versus going for surgery. So we definitely would be giving you a referral to our orthopedics team. A lot of our orthopedics team also does sports medicine, so they're on site too. And sometimes when they recognize something needs to be seen and triaged quickly, they're already going to jump on it. And we have a really great physical therapy team as well. So after the surgery, we do encourage physical therapy. Most
Okay.
of our athletes are probably going to just require physical therapy, but I do believe that when surgery is necessary, they'll definitely let you know. And there's nobody who wants to operate on a young athlete if they don't have to.
Yeah, for sure. PT is such an important part too, to safely get back onto the field. And as someone who has gone through PT multiple times, it can be tenuous and tedious, but it's so helpful to get your bearings back. Um, I know we just kind of blew through a lot about sports medicine. There's so much we could talk about with sports, especially in Houston area. Anything else we need to be mindful of this fall season?
Um, I think just, remembering to be open with your physicians or your providers and making sure our athletes really do get seen and evaluated by a professional whenever, they are injured, and just remembering to have fun out there.
Yes, have fun and be safe. And that is one thing I love about UTMB Health is you guys really have truly comprehensive care. And so if the worst happens and your athlete is injured, you can see someone like Dr. Leung, they can refer you out to their UT be orthopedics team and get seen and taken care of and get you back onto the field. And I've loved chatting with you today. Thank you so much for your time.
Thank you so much for having me. It's been a pleasure.
Yeah, absolutely. And so until next time, we'll see you next month with another timely and relevant health topic. And as always, we'll pop in the comments below all of these team members that you can see at UTMB Health are preferred providers for the Bay Area, League City, Galveston. Until next time, we'll see you guys.